Hey, it's Dr. Gregg with Align Wellness Center, and I just wanted to take a few minutes to share with you a colleague of mine that I've been studying with the last several days. This is Jeb McAvaney with ScoliBrace. Now, Jeb's come all the way from Australia to America to teach chiropractors on one of the most advanced conservative methods of bracing scoliosis as well as rehabilitating scoliotic spines. Now, Jeb, I wanted to just ask you a couple quick questions.
Yep.
What got you into scoliosis care and bracing?
So my father is a chiropractor, and it's something that he had a passion for as I was growing up, and I got to see a lot of scoliosis patients in his practice, and one of the big things that was missing was a good scoliosis brace. And then over the years we've tried lots of different approaches to bracing and found that there are some positives for different systems and some negatives. So we tried to take away all the negatives that we found. So in a traditional brace you might use a plaster cast for a patient. That can take up to an hour, it can be pretty uncomfortable. And then the end result, it's very hard to mold a consistent brace. So we would take the negatives out of that and use things like our 3D scanner. So it takes about 8 minutes to do a scan. It's really comfortable for the children or for the adults, and we can get reproducible, consistent results using that approach as opposed to that old-fashioned approach where we're doing plastering, for example. So just being able to innovate and really put together a system that we feel takes away a lot of those negatives has been the inspiration to developing ScoliBrace to where it is today.
And you mentioned one area that I'm really excited about and actually have used the brace for, and that's with older adults. Now, what typically do older adults experience that make them be a candidate for potentially needing a ScoliBrace?
So when we get older, our spine tends to degenerate, and once you get past about the age of 65, about 30% of the population have an adult degenerative scoliosis. And right now there are not a lot of good treatments out there. Surgery can be risky and might not get the results that people are looking for. A lot of these patients present with pain and problems with the activities they're doing daily. So the goal of bracing here is not necessarily to make the patient super straight, but to improve their alignment, improve their pain, improve their quality of life, and really use the brace as a life improvement tool rather than something just to try and straighten the degenerative spine. And adults seem to respond really well to that. They enjoy wearing the brace, they can function better, play with their grandkids better, do gardening, things like that, and really improve their quality of life.
Well, thank you so much for coming over, sharing a little bit about why you do this and who it's for. I'm really excited to be able to start offering this to some of our patients and to our community, and I'll talk with you guys later.
Thanks so much.